Welcome to Healthy Frontiers, a show dedicated to the education of our viewers. Tonight's topic is hearing well in the 21st century. I have a special guest with me, Mr. Steve Mohink. I want you to stay tuned at the end of the show because you'll have an opportunity to go on our website and ask questions to Mr. Mohink or myself, or to make an appointment for a complimentary consultation and exam with Mr. Mohink or myself. So I'd like to welcome Steve tonight.
Thank you.
How you doing, Steve?
Doing fine, Dr. Bizzoni. Thank you for having me.
It's my pleasure. Steve, before we start talking about hearing in the 21st century and what's new, why don't you tell me a little bit about yourself and your background, how you've evolved into where you are today?
It started off when I was a teenager. My father had a hearing loss.
Okay.
I went to school, went further, started working for a hearing aid company, became a licensed New York State hearing aid dealer, which I've been for the past 40 years. Mm-hmm. And we have 3 offices, actually. We have a Manhattan office, a Bronx office, and one in Somers.
Okay.
We work with many, many children, many nursing homes, many HMOs. Mm-hmm. We have 12 people in our Bronx office and 3 audiologists on staff at all times.
Great. Okay, so you have a large facility and you're ready
Yes.
to go. Okay. Do you think kids are affected more than adults, or adults are affected more than kids? What do you think as far as hearing loss?
Tough to say.
Okay.
We on our rolls we have many more adults, but we also have about 1,000 children. We take care of most of the children in our area because they're recommended to us by Rose Kennedy Center, the Russo building.
Okay. All right. And what are some of the symptoms of hearing loss? What would you say?
Well, you don't hear the telephone. You're having a problem with the doorbell. You ask people to repeat.
Okay.
You keep the television much louder.
Mm-hmm.
You start avoiding people that you have a problem with and try to take the conversation over so you don't have to answer.
I see. Okay, so there are a lot of things you can look for
Yes.
with hearing loss. Are there different types of hearing loss? I understand there's several different types.
Yeah, there's basically 3 types of hearing loss. There's a conductive hearing loss,
Okay.
there's a mixed hearing loss, and there's a sensory neural hearing loss.
Okay.
Sensory neural hearing loss is known as a nerve hearing loss.
Right.
Those are most of the people that we work with.
Okay. With sensory hearing loss, is that something that is permanent, or is that something that can be?
It's permanent.
That's a
That's
permanent
permanent
problem.
loss. Yes.
Okay. What is the first one that you mentioned?
It's conductive, where your pathways are blocked. Your ear canal either has some wax in it, or you have a problem with your eustachian tube, or there's fluid in your middle ear.
Okay.
Those are conductive type of losses.
So it's more the outer ear, middle ear for that conductive
that's
loss,
for
would
mixed.
you say?
Mixed is outer, middle, and inner.
Oh, okay.
With mixed, it's the outer and the inner, or the middle and the inner.
I see.
It's not all nerve. That's why it's called
Okay.
mixed.
Okay. You know, there's some cilia in the ear. Is it really in that deep ear portion that the nerve is being affected, or is
Yes.
it's the
Yes.
actual nerve?
Yes, it's the nerve itself.
Okay. And so, person comes in with hearing loss. What are some of the causes of hearing loss?
Oh, it could be hereditary.
Like, you mean?
From a grandmother, from a grandfather who had a hearing loss, could have passed it on,
Okay.
as they do, their money.
Right.
It's just hearing loss.
Yep.
It could be from excessive noise. There's
Okay.
2 types of trauma. There's noise,
Mhm.
and there's an emotional trauma, as you find a loved one that has maybe passed away unexpectedly. That can cause a loss.
Okay.
Very loud noise.
Okay.
Wrong medication, excessive medication.
Mm-hmm.
There's so many things that can cause hearing loss.
Infections of kids had
Infections,
mumps, measles.
yes.
Is that
Yes,
some
it's
of the
very,
problems?
very bad for a mother that's pregnant
Right.
to get any of these diseases because normally it causes hearing loss.
Okay.
If you bring a high fever down too quickly.
Yep.
Years ago, there were 2 drugs, the mycins, that we used very often. One was kanamycin, the other was streptomycin.
Yes.
They were causing almost instant hearing losses,
Mm-hmm.
and they didn't know why. The only
Right.
time they use them today is for fatal kidney disease, and it's still monitored very carefully and still cause some type of hearing loss.
Okay. Interesting. How about if someone has some trauma to their head, or could that cause a hearing loss as well?
Absolutely. It could cause either a permanent hearing loss or hearing loss that will be around for a short period. It's difficult to say.
Okay. How How about kids going to rock concerts and,
Oh,
tell me about that. Is that something that if you go to one concert, it can cause a hearing loss of permanent damage, or is it more cumulative over time?
it's usually cumulative over time. What's happening is that a survey was run about 4 years ago
Yes.
on people that are going to concerts, and they found that 15% of them already had an irreversible hearing loss.
15%
Yes.
already.
That's a sensory neural hearing loss.
Okay.
Noise will cause nerve damage, which in turn causes a sensory neural hearing loss.
Okay. And so if kids keep going, they could would that get worse and worse as time goes on?
It possibly could. It's difficult
Okay.
to say. It has to be monitored, but the chances of it getting worse are greater than them not getting worse.
Okay. And what would you recommend to a kid someone who likes to go to concerts? Or
Earplugs, so they can enjoy the music without it being harmful.
Great. Okay. Can a difference in pressure cause any kind of hearing problems, like a barometric pressure change in a...
Well, it can affect your eustachian tube. If your
Right.
eustachian tube is dysfunctional,
Yep.
it can't give you the right air pressure. So
Right.
in that case, you will have a temporary hearing loss,
Temporary.
a conductive hearing loss.
Okay. Can something like, I think you mentioned antibiotics, something as simple as
Yes.
aspirin or so, can that cause...
Aspirin and quinine are known to affect the hearing in excess.
Okay. So many different reasons why.
There's so many different reasons.
How about age? An aging person?
Presbycusis.
What's that word?
Presbycusis.
Okay.
Also causes a hearing problem.
Okay.
That's the aging process.
Okay, so people are going to lose their hearing. Is there a time in life
It's-
that people start to lose some of their hearing anyway,
Uh,
on average?
difficult to say.
Okay.
Normally, when you're over 50, you start looking for hearing loss. There are many people that are born with hearing loss. There are people at middle age that have hearing loss. It's just so many different reasons.
Only reason I say that, I had read somewhere that after age 20, many people will start to have some type of hearing loss.
In large
you know?
metropolitan areas where there's much more noise than, the suburbs,
Right.
you have more hearing loss there.
That would
much
make
more
sense.
hearing loss.
Okay. Even occupational, say somebody's working with loud
Sheet
noises.
metal worker, construction worker, absolutely should use some type of a headset or earplugs.
And if they wear, you see guys or women
Sound
wearing
cups.
these sound, what are they called?
Sound cups.
Sound cups.
Yes.
And do they significantly make a difference?
Yes, they do.
They do.
Yes,
So,
they do.
Okay, so you probably now see a lot less problems from an occupational
The
standpoint.
problem is most people are not wise enough to wear them.
Okay.
So your hearing loss in the industry is pretty much the same.
So the industry is saying, look, guys, you wear this, and they're saying, well, they'll just get to work and think it's not that important.
Exactly.
It's too late.
Exactly.
Okay. I know, like a Meniere's syndrome could cause a hearing loss. Is that right?
Meniere's syndrome can cause a hearing loss. Tinnitus can cause a hearing loss.
Okay.
In Meniere's syndrome, there are
Tinnitus is, I'm sorry, just take me back.
Tinnitus is a noise in the ear.
Okay. So,
In some cases, it's a high-pitched whistle. In other cases, it's the sound of the ocean.
okay.
People have a very, very hard time sleeping with this noise because it's so loud.
Mm-hmm.
So what's suggested is either they get a noise machine that gives the sound of waves or the forest, or they listen to a radio or a television at night. Just keep it on. That will
Okay.
help overcome the noise.
Okay, so they hear this noise. What's the cause of the tinnitus sometimes? Do we
It's-
know?
Actually, there are so many different reasons. There's no cure for it. There are treatments they're trying at the Tinnitus Foundation,
Okay.
and a lot of research is going on. There's been no cure for it as of yet.
Okay, nobody's found the cure, and nobody knows the reason why people get it, basically.
Well, you can get it from excessive aspirin. You can get it from high blood pressure. They know a lot of reasons that can cause it. They
Right.
don't know how to cure it.
They don't know.
No.
If we go back to the loud noise situation, is that something if someone...
Possibly.
that could be a cause also.
That could be.
Okay. And a lot of these can be permanent, correct?
Absolutely.
All right. And some of them now, some of the reasons that we talk about, maybe wax in the ears or so, is obviously something that can be temporary, where
Yes.
if you have wax in the ears or you've had an allergy or something, is that true? That could...
Yes, the first thing we do before anyone's ears are tested is look in them.
Right.
We do an otoscopic exam to make
Right.
sure they do not have excessive cerumen.
Okay. And if they do?
They're recommended to an ear, nose, and throat doctor immediately.
Is there something that they can do on their own if it's just a wax
We
buildup?
prefer that they don't. If it's minimal wax, our audiology department will handle it themselves. They're licensed to do that.
Okay.
And they're schooled to do that. If it's
Okay.
something major, we will recommend them to an ear, nose, and throat doctor. We do not tell people to take care of their own problems. They can't see what they're doing. It's very difficult to do that. They
Because
can be harmful to themselves.
Okay, because we've heard of, you go to a drugstore and you
They
can
can
get
rupture
some
their
drops.
eardrum doing that. It doesn't pay to do it.
Okay, good. So, can a hearing instrument help everyone then?
No.
Say they have a hearing problem. They come to your office now. Can a hearing instrument help everyone?
No.
Okay.
It depends on a number of things. There are two things very, very important when we measure hearing. One is how loud we have to make the instrument. Number two is what their discrimination is. In other words, we will ask them 50 words.
Right.
And we will give them 2 points for each word.
Yes.
If their discrimination is good enough during the test, and we can give them the volume that they need, we can help them.
I see.
If their discrimination is poor,
Yes.
we can't make them hear clearly.
Ah, okay.
If their discrimination is very poor,
I understand.
it will still help them with danger and maybe telling direction,
Right.
but in a lot of cases cannot be helped.
A lot of people cannot. Okay. And I'm sure now, in the 21st century, a lot of different hearing instruments, and we call them instruments. I keep saying instruments. Is that the correct term?
Oh,
Or
yeah.
What is the
That's
difference between a
hearing-
hearing instrument and a hearing aid?
Well, hearing aids years ago used to be just, they were analog, it was really guesswork when you were adjusting them because you had high frequency, low frequency, and power, just screws to turn. So you're really guessing and more or less knowing what you were doing, but not really knowing how satisfying it was to the individual wearing the instrument.
Okay.
Today, you have things like this,
You've been wearing that thing this whole show? I
Yes.
didn't even see it.
which is an open ear fitting.
Wow.
The best thing with this hearing instrument is that people say that I don't even know I'm wearing anything. It's pretty new. It's made by a company that is doing very, very well. In fact, there are a number of different colors that it comes in.
Okay. That's similar to the braces that kids are getting these days, huh?
It's known as an open ear fitting.
Right.
And the nicest thing is to hear the user of the instrument say, I don't even know I'm wearing anything. This is wonderful. Not everyone falls into the category, but we're able to fit people today that we could not fit years ago.
Just explain that to me. You can't fit people today that you could fit years ago.
No,
Tell
the
me.
reason, because many times people have a precipitous hearing loss. A precipitous hearing loss looks very much like a ski slope,
Okay.
where your low frequencies are good, your middle to high frequencies are not good.
Middle to high frequency. So what's an example of a middle to high frequency?
Okay, say 1,000 to 4,000 or 1,000 to 8,000
Okay.
hertz.
Okay, so what would that be in terms of something out in the...
Women's voices, the sound of a telephone, someone ringing the doorbell.
Okay, so those are high-pitched voices,
They are high-pitched sounds, yes.
Okay.
Groups of people.
and that'll make a difference as to the
Yes,
type of hearing aid that you're going to recommend.
Absolutely. With a normal hearing aid, the people's voices sound a little funny to them. They will to begin with because you really don't remember what your voice sounded like.
Correct.
With the open ear fitting,
Mm-hmm.
there are almost no lows whatsoever in the instrument.
I see.
It's all mainly going to help your high frequencies.
Okay.
So it's a wonderful, wonderful fitting. It's a wonderful thing.
Once you get one of these hearing aids,
Yes.
is it similar to glasses where, you start wearing glasses at one strength and then, later on you need a stronger strength? Will that happen with the hearing aid situation?
It's possible that it could, but the good part about digital and programmable hearing aids is that if the person does have a hearing change, we'll retest them every year.
Yep.
We can usually adjust the instrument that they have
So they don't
to
have to keep
accommodate the
finding a
hearing
one-
loss. In most cases, no. There are
Okay.
some cases they do.
Right.
They choose to for their own comfort, or they want something smaller, or there's something newer.
Sure.
But most of the time, we can adjust the instrument that they're wearing to fit the change in hearing loss.
So if you bought one of these,
Yes.
do you get a warranty or something with this?
Absolutely.
And how long does that?
This particular hearing aid comes with a 2-year warranty.
2-year warranty.
Yeah, it's
okay.
2-year on loss. I'm sorry, it's 1 year loss, theft, or repair.
Right.
And it's 2-year on the instrument itself.
Okay. And this, show me that again. This is the newest instrument there is?
This is the newest instrument that there is.
Okay. And
It's
that
an open
small.
ear fitting.
Can you put that on your ear
Sure,
again, Steve?
because
Let's just
you
see.
do not have to take an impression.
You do not.
You do not. It comes in various different sizes. And let me tell you something that amazes me with this. This particular company, which is called Oticon,
Yeah.
has come out with what is known as an artificial intelligence. Most hearing aids wait for the sound to come to it before it adjusts to it.
Okay.
This instrument goes out and looks for it, and it's already adjusted by the time the situation has changed.
That's real interesting.
Yeah, so it's really environmentally, it's great.
Yeah.
It's a great instrument.
Okay.
As I say again, it's not for everyone,
Okay.
but it can accommodate a large amount of the hearing impaired.
So just one more time to sum that is it would not be for everyone.
No.
Who would it not be for? Who would not want to buy this instrument?
People that have a pretty severe hearing loss, moderate to severe hearing loss,
Right. What would they do?
they would wear a different type of instrument.
Okay.
They would not have the problem of the people that have the mild to moderate hearing loss with the sound of their voice, because their hearing is so much more impaired.
Right.
So they would do fine with a different type of instrument, something like something that fits in the ear.
Okay. Now these look like the older models that we're used to seeing around.
That's an older
That's
model,
right.
and also today made in digital. These are the smallest, known as the CIC.
Okay.
The reason there's a little piece of fishing string attached to it, you can't get it out if it's not.
Ah.
It's
That's small.
it's not seen at all.
Okay. And this is the entire piece right
That's
here.
it. Battery inside.
How does that differ from one of these?
Well, this
guys?
is much stronger. This is what a younger child would wear, and to help them, we make them in colors. We make the ear mold in colors
I see.
so that they're more comfortable wearing them. We let them pick their color.
Oh, how nice.
Yeah,
so a child would wear this, even though it's larger, but it's colorful and playful, sort of.
They come
versus
smaller. They
something
come.
like
They
this.
come this size also.
Oh, I see. Okay.
They come in various
And that
different
would
sizes.
probably be for a child also.
Yes. Attached to that, you have an ear mold,
Okay.
which can be in a color or it can be to the color of the person's skin. Actually, I brought 3 different samples. If the person has a darker skin,
Right.
the person is light,
I see.
or if the person chooses a neutral color.
Okay. And any of those are almost unseeable
Yeah, well,
inside the ear.
yeah, well,
You know.
we blend it as well as we possibly can.
Right. Great.
So there are so many advances that people are not aware of.
Sure. What is? I see on the table here we have.
Yeah, this is an audiometer. This is
An audiometer.
state-of-the-art equipment, brand new. It does 3 different things. It tells us more or less if there is a hearing loss, what kind of hearing loss, and where we go from there as to whether a hearing aid is recommended, as to whether they should see a doctor for maybe an operation or medication or some type of wax removal or...
Which we want to always emphasize that it's not
Absolutely.
always just the hearing loss that needs a hearing aid, certainly.
no.
I mean, always have that medical checkup.
If they do not need a hearing aid, we will be the first to tell them.
Right.
We
Okay.
work with many doctors,
Yep.
and we prefer someone always to see a doctor.
Before.
Yeah, if they do, it's not necessary. It's not required by law.
Right.
They can sign a waiver, but we prefer that they do.
Okay. And this is done in your office
Yes.
on every patient that comes in.
Every patient that needs a hearing test, yes.
Okay. And once we have this test result, then we know which type of hearing loss they have.
Exactly.
What type of hearing aid they're
Yes.
best suited for.
Yes, exactly.
Okay. Well, that's great, Steve. Can you tell me what are some of the things we can do to prevent hearing loss? I know we touched on loud music. Is there anything else that we could give some advice to people at home?
Yeah, even when you're vacuuming, go to your neighborhood pharmacy and get some earplugs and use them. Anytime you're around noise, It's very harmful. Do
Okay.
something to stop it. Use earplugs.
Okay.
If you're mowing the lawn, if you're vacuuming, no matter what it is, power washing, use that.
I
It's
see.
working on automobiles, use it.
Okay.
It'll help you in the long run.
Okay. And in the occupation, put those
Either the
earpieces
cups
on.
or we also make custom-made ear molds.
Custom-made ear molds. Okay.
Yes.
Tell me about those.
Well, we can put filters in them to determine how many decibels we want to lessen in the environment that they're in. We can go into their environment with a sound level meter, and we know exactly what to do to the ear molds.
Is that right? So you
Yeah.
can walk into a factory, and you'll know exactly the
We
strength
measure
of
the
that
noise level. We know exactly what kind of a filter to put into the ear molds, which are actually noise protectors.
And have you worked with any companies on that? I mean,
Yes, we've worked with a few.
You do.
Yes.
Okay, so they'll say, "Come on in here, Steve, and let's see what we can do to help our employees."
It's a noise management program.
Yeah, interesting.
Yeah.
I didn't even know that companies had that in place. To be honest.
Well, a lot of companies have many lawsuits from this,
Okay.
and it's not necessary. You can prevent it.
Right. From the hearing loss problem.
Yeah, you can prevent it.
Okay. Great. Well, is there anything else, Steve?
That's
Okay, I
it.
think you did a great job. I want to thank you for
Thank you,
being
Dr.
here.
Bizzoni.
I think it's
Thank
been
you for
terrific.
having me.
It's been my pleasure. Steve is a good friend and a good colleague. And if you have any questions for myself or Steve, please go to the website and ask us those questions. And I'll show if you email them to me, I'll email them over to Steve. And if you wanted to have a hearing test or you wanted to have a complimentary examination, please call us or email us, and we'll be happy to do that. So thank you, and good night.